Hi, everybody. Feel free to still fill up your coffees. I'll be right behind you. Just want to thank you all for being here today. This is a great group. This is a passion topic. I'm so excited that so many of us are here thinking about how we can enhance basic needs supports for students. So I'm really excited to get to introduce our speaker for this session and hopefully many more to come. Before I do that, just a quick PSA for the Impact Exchange. Has anybody had any challenges accessing it or even knowing what it is? It's where you can scan the QR code on the back of your name badge. If you're on a computer or laptop, you can just type in tinyurl.com/2023 KY Summit. You will have access to so many amazing resources, presentation slides, infographics, data dashboards, all the good stuff. So dig in. And of course, the Impact Exchange exists far beyond the summit as well. And it's chock full of a lot of different resources that will help us all in our many roles that we play on our campuses. Yes. It will never go away. Indefinitely. Okay, so we're here today to focus on basic needs. Many students face challenges accessing and completing a post-secondary credential due to affordability and living costs. A variety of public programs exist that can support students' basic needs, and institutions play a critical role in ensuring they are aware of and know how to access the full scope of resources available to them. Today, we'll explore how connecting students to public benefits complements existing higher education efforts to help students succeed. I'm pleased to introduce Carrie Welton, the Senior Director of Policy and Advocacy, Anti-Poverty and Basic Needs at the Institute for College Access and Success. Carrie's work focuses on improving federal and state policies to better support the ability of people with low incomes to access and complete post-secondary credentials. Her experience as low-income single parent and a first-generation student striving to complete college informed her desire to improve policies and systems with an explicit focus on closing equity and attainment gaps for students of color, parenting, first-generation, and immigrant students. By ensuring programs that provide basic needs assistance serve students by prioritizing education activities over low-wage work that can lead to longer-term economic security. Carrie established herself as a trusted public benefits policy expert in her previous role at the Hope Center for College, Community, and Justice at the Center for Law and Social Policy in Washington, D.C. Her prior work experience includes the W.K. Kellogg Foundation, the Kellogg Company, and the American Civil Liberties Union of Michigan, furthering residents' civil liberties and civil rights. Carrie has a bachelor's degree in public law from Western Michigan University and a master of public administration degree from the Gerald R. Ford School of Public Policy at the University of Michigan. Please join me in welcoming Carrie Welton.
Thanks, Lily. It was a very lovely full introduction. You did the full one. That was appreciated. I also find it weird to have my slides behind me, so I'm going to try to remember to speak into the mic. Hey, y'all, great to be here. I'm Carrie Welton, as Lily said, proud former community college student, first-gen college grad. It actually took me 12 years to get my 4-year degree, and it was through some of those challenges trying to work and be a parent and achieve my college credentials that really highlighted the challenges that people face and really the way that systems are stacked against students who are trying to achieve economic security through a post-secondary credential. So I'm going to be talking to you a little bit about poverty metrics and eligibility and how that affects students, and just really kind of want to set the context for why do we talk about and focus on basic needs. We throw around a lot of terms like poverty and eligibility, but what does that really mean when we're thinking about the students that we're trying to serve? And then we'll talk a little bit about disproportionate outcomes and how the systems as they're currently created are themselves the barriers for students. I think it's a really important context because students themselves should not be blamed for the circumstances they're in. There are a lot of factors that affect their ability to be successful despite their best efforts. And then we'll talk a little bit about the student basic needs and public programs, and then a couple of immediate and longer term opportunities to support students. And I'll try to leave some time for questions as well. So when we talk about poverty in the United States, this is the metric that we usually use. This is prepared by the Census Bureau, and it's called the official poverty measure. Our last measurement showed that almost 38 million people in this country were living in poverty, and that was almost 12% of the population. And this is the number when you do the breakdown across Kentucky, and you can see that your statewide average is slightly higher than the national average. But what does that mean? We talk a lot about living in poverty without really understanding what does that mean for a person. So when we think about living in poverty, this number here on the left is the one that's put together by the Census Bureau. Income eligibility for federal programs is determined by the Department of Health and Human Services, and it's slightly different. It's for the purpose of determining eligibility. So when we look at this number here, and I've highlighted the example of a person in a 3-person family, I'll use that example a couple of times, as is they're making $21,831 a year. And that person lives in poverty, that family, that household, single parent with 2 kids is how I think about it. Anybody under that number at that household side is considered in poverty. Once that person makes $1 more than that, they are no longer counted as in poverty by our official poverty measures. It's an absolute line. And I would just like to think about, I made close to this amount at some point in my career. And just to contextualize what that means to be counted as poverty when you're $1 over this amount. And then when we think about how that translates to eligibility for programs, and the Supplemental Nutrition Assistance Program, SNAP, formerly known as food stamps, or provides food assistance, they use the measurement of 130% of the federal poverty level for income eligibility. So that same 3-person family at 130% of the federal poverty level would lose their SNAP once their annual income rose above that $32,318 amount. Now, luckily for you in Kentucky, you leverage a policy called broad-based categorical eligibility, and that allows your state to raise the gross income limit all the way up to 200% of the federal poverty level for certain programs. And what this really looks like is, it's like, I don't know these numbers by heart, so I'm just going to rotate around. What this really looks like is federal eligibility for SNAP at 130% of the federal poverty level at that 32,000 number equals about $26.93 a month. And in Kentucky, that's about $49,720 a year and $4,143 a month. And that represents about 31% housing, average housing cost represents about 31% of this family's income. So when we think about how much is left over, given what somebody's expenses are, we really start to connect the dots of why accessing and completing a post-secondary credential is that much more difficult for people with low incomes. Now, broad-based categorical eligibility, or BBCE, is a policy that has been under scrutiny in the last couple of years. And I want to just mention why this policy is so important. I'm not sure if anybody here has ever heard of the cliff effect, but the cliff effect is when somebody who is receiving benefits receives a very small raise that puts them over that absolute line. And that small increase in income can result in a total loss in benefits, which actually leaves them worse off than they were before receiving the raise. When you raise the gross income limit in a program up to 200% of the federal poverty level, that allows this person's income, this family or household's income, to slowly rise and their SNAP benefit slowly decreases. So when we think about the design of programs and why they're so important, policies like this are worth protecting because it allows people to cross an income threshold and lower their benefits slowly as opposed to an abrupt cutoff. So at that 130% of the federal poverty level, that family would have experienced a total loss in those SNAP benefits and may not have been better off for their raise. It's a little bit complicated, but I think it's important mentioning because it's a policy that Kentucky should be really proud of and increases eligibility for programs, which supports more of the students that you care about. And so when we think about U.S. poverty measures, they drastically underrepresent hardship and therefore undercount the actual number of people who are really struggling to have their basic needs met. And that's what I really want to impress upon you is the number is already set artificially low and it's a hard line. And then when you consider how that affects income eligibility, you're already not capturing people who have need, even with an income level set at, say, 200% of the federal poverty level. That sounds very bleak, but I say all of that to reinforce that it's so important to connect people to the benefits for which they may be eligible, because we know how great the need is and how low those eligibility thresholds are already. And so when we think about the challenges that our students are facing, which what a great session earlier today, really set the context very well for all of these things. But this is sort of what I think of as the ecosystem of things that people with low incomes are traversing when they're trying to access post-secondary education to achieve their own long-term economic security. And we really think about stigma and narrative at the forefront, because this country has done a phenomenal job of shaming people for being poor. And it's not, frankly, not just this country, but overcoming those barriers for people who are eligible for benefits to just convince them to access them. It is a taxpayer resource. So anybody who has ever had a job, much like Social Security or unemployment insurance, that is a benefit that is available to people, whether they are working their way out of poverty or even experiencing a short-term financial hardship by which they need to access benefits. And then we think about higher education norms. I know it was my experience that despite having a low income and trying to go to school while I was a single parent parenting my son, I experienced barriers that made it very clear that when they said you should go to college, they didn't mean people like me. And the higher education system that we have been built on middle class normative values about what it looks like to have the right pathway to college. You graduate high school and then you go to a four-year institution and you graduate, and then you have maybe a meaningful career for a couple of years and get married and have 2.5 kids and a golden retriever. And a lot of these structures and systems are what our higher education system were built on, that frankly, I think there's been massive progress in the last couple of years to recognize that students are overwhelmingly working, they have caregiving responsibilities, they have unpredictable schedules, and like someone said earlier, I don't remember if it was Dr. Thompson or not, higher education is adapting to the needs of students, but it's kind of like a giant ship in the ocean, and you can start turning the wheel, but it sort of takes a while for the entire ship to catch up. And it was mentioned earlier also, employment outcomes. We know that the Bureau of Labor and Statistics, who tracks occupations and the education required for them, are predicting that entry-level jobs that require some form of education beyond high school are actually predicted to grow faster than average. So this need is only going to continue. And then when we think about policy barriers, our safety net programs have been built under this premise of what they call work first. Clinton, under welfare reform, made it very difficult to participate in educational activities if you were a person who were receiving public benefits. And this is still true today. So the SNAP program, TANF cash assistance program, you call it KTAP here in Kentucky, your childcare subsidy programs are rife with restrictions on post-secondary education. And I think that's important when you think about this ecosystem of somebody who is essentially in a low wage job on public benefits. And then they're told, well, if you can't support yourself, then maybe you should get some more education. And you're like, okay, well, let me go try to get more education. You're like, well, I can't also be on public benefits and get education and work. And so we've created this like closed door system for people that makes it really difficult to sort of contort yourself into all of these rules and systems. I'll talk a little bit more about the student restrictions in a minute. All right, what do we got? So one of the things that I wanted to mention that's really important for context, and I'm glad there was such a focus on equity earlier, is that we know that family income is a strong predictor of a wide range of child outcomes, including a family's ability to support their child to go to college. And individual and systemic racism in the forms of employment discrimination, housing discrimination, over policing, and much more have harmed the ability of families of color to accrue wealth and to pass on that wealth and support their children at the same rates as white families. Potentially the best example is the 1934 or 54 1934, it's probably 54, don't quote me on that, Housing Act, which openly backed mortgages for low-income white families while denying them to low-income families of color. And the differences in household wealth between white families and families of color is actually cited as the difference between value and ownership of homes. So when you think about how all of these factors compound and affect student of color ability to be successful in school, we see why we have some of the disproportionate outcomes in higher education. And I think that context is really important anytime we're talking about data and anytime we're talking about student outcomes. Lily shared a couple of these earlier, so I'm probably not going to go over these in detail, but they were just like too good of a fit not to use, and frankly have really good Kentucky data. So essentially, we know that students are facing basic needs insecurity. 3 in 5 students are facing some form of either food insecurity, housing insecurity, or homelessness. And I actually think it's really interesting that we call it basic needs insecurity. You know, we just call those living expenses. But because there's this perception that by the time somebody gets to college, they should have resources or that they do have access to resources, we call it student basic needs insecurity. So thinking about what language we're using and how we're sort of separating populations of people and how that shows up even in our data is important to just pause and think about, like, why do we say student basic needs insecurity as opposed to just they can't afford their living expenses? In addition to that, we know that the rises in cost of attendance, along with the increase in enrollment of students with lower incomes. As a matter of fact, in the last 2 academic cycles for which we have data, students with lower incomes that are students who are at or below 200% of the federal poverty level now enroll in college at rates higher than their middle and upper income peers combined. So over 50% of students enrolling have incomes below 200% of the federal poverty level. Okay, so student basic needs insecurity, obviously for the systemic and cultural reasons that I just mentioned, experience basic needs insecurity at higher rates. And I actually think it's important to remember that as a percentage of the population, well, let me rephrase that. There are more white people in this country that live in poverty than there are people of color. As a percentage of population, Hispanic and Black families make up a larger percentage of poverty because of those systemic factors, because of their lack of access to family wealth, intergenerational wealth, the inability of their families to help them go to college. Lily already shared this, so I'm going to skip over this one. Okay, so I just mentioned this. So there's been a decrease in higher education funding over the last several years, and an increase in the enrollment of students with lower incomes. Now, students with lower incomes intuitively know that a college credential is going to help them access a better paying job. With some of the barriers that we're continuing to face, though, are how do you make that transition from having low income to getting the credential you need and surviving through that process? So it sounds to me like you all are undertaking a massive amount of efforts to do just that. And I look forward to figuring out where are the ways that I can continue to inform and support those efforts. Oh, okay. Lily shared this one as well. So these are the effect of student basic needs insecurity. Okay. So sorry, I just need to look at my slides. These pillars on the left are the resources that we traditionally think of in higher education as supports that are available for students. And then when we think about an expansive model that provide comprehensive supports for students, I include federal and state means tested public benefit programs. Now, there are certainly a broad variety of other programs that are available through workforce development, things like WIOA. I focus on most of these because they act like cash. So as opposed to a person who enrolls in a program and has access to supportive services, these programs actually provide a benefit that offsets a household's living expenses. So the Supplemental Nutrition Assistance Program and its partner SNAP ENT provides food assistance. It's the nation's most effective food assistance program. It's estimated that for every $1 of SNAP spent in a community, it generates $1.50 of economic activity. And SNAP is also considered it's what's referred to as countercyclical. So because of the design of SNAP, it actually responds in a economic downturn. So people have more access to SNAP, so enrollment increases. That's considered good program design. In SNAP and SNAP ENT, I just want to mention also, because there have been a lot of, I think, discussion about this in the national dialogue lately. SNAP has two different sets of work requirements and has since the 70s. In the SNAP program, if you're a student who is trying to access SNAP, you first have to, well, everybody has to meet income, household, and citizenship criteria. And that's for all SNAP applicants. And then the SNAP program says, are you enrolled at least half time in an institution of higher education? No, okay, you're not considered a student for SNAP's purposes, and you could be eligible to one, if not both, of SNAP's work requirements, unless you meet a different exemption, like being disabled or having a child under the age of 6 for whom, you have to, you can't find childcare for them. So there are a couple exemptions. If you are a student who is enrolled at least half time, you can meet one of several exemptions that allow you to access SNAP. I think a lot of people say students can't get SNAP because it's incredibly complicated. So like that, I guess that's partially true. But in terms of the policy levers, students can get SNAP. And in Kentucky, students who are making up to 200% of the federal poverty level. So some of those exemptions include if a student is participating in federal or state work study, if a student is working 20 hours a week on average, which states have the opportunity to average those work hours over a month, a trimester, semester, over an academic period. And it's important to note that if a student, let's say a student is work study eligible, they don't also have to be working 20 hours a week. They only have to say yes to one exemption, and that confers their SNAP eligibility. One of the issues is the programs that a student can participate in to confer their SNAP access can be limited, and states are making efforts to expand those programs. Kentucky has included a number of career and technical programs that if a student is enrolled in it and they meet all of those other income, household, citizenship criteria, and are enrolled at least half time, they meet that exemption for SNAP. Some states have decided to take a more expansive view in that of include, say, like all of their community college programs. The SNAP Employment and Training Program is also incredibly beneficial because in addition to conferring SNAP benefits to a student could also get supportive services such as tuition, books, childcare, transportation, help with things like uniforms. I know that in Kentucky, looking at SNAP ENT as a more expansive model on your community college campus has been attempted and continues to be an ongoing goal. And one of the benefits of that is institutions that are leveraging SNAP ENT resources can draw down a 50% match for the money they're spending from the federal government. So some states have actually turned this into a profitable model for their community colleges who were likely already providing services that were covered under SNAP ENT already. And then we think about the Temporary Assistance for Needy Families program, cash assistance, which is to what we traditionally think of as welfare. KTAP, TANF's eligibility income levels are actually far lower than in the SNAP program. And there's a federal 12-month limit on post-secondary education activities in the TANF program. One of the things I do for my day job is advocate for federal policies that improve access to post-secondary education, and that one's at the top of my list. States can choose to expand that 12-month time limit, but they have to use state dollars to do it. So it's not always a feasible option. And then TANF also has restrictions in it that promote work first over education. Same with childcare. TANF and childcare are block grants. SNAP is an entitlement program, which means enrollment expands with need. Whereas TANF and childcare are a set bucket of money that states get. When that money is gone, unless they're bringing additional money to the table, it's just gone. So it doesn't meet the need of all eligible populations. But both of the programs have restrictions on education. Childcare does not have a time limit restriction in this. Well, some states have implemented time limit restrictions. For example, one state limits childcare subsidy access to programs that can be completed in less than 6 months. That's the most strict option that I have seen in the nation. But there are other restrictions in TANF and childcare, such as having to meet academic GPA requirements and being enrolled a certain number of hours and being limited in the types of degrees and credentials that you can pursue. I include Medicaid because I know Medicaid has been a topic of discussion in Kentucky. At present, there are currently no work requirements or student restrictions in the Medicaid program. This is an ongoing issue, though, because as you may have remembered a couple of years ago, there were efforts to implement work restrictions in the Medicaid program that have gone all the way up to the Supreme Court, and the Biden administration has asked them to hold off on making a decision while they're reviewing their policies. All of that is to say that states are still very interested in Medicaid work requirements, and this issue has not gone away, or it's at least not resolved. At present, it's currently incredibly important to connect students to Medicaid to access both physical and mental health care, and institutions that have healthcare providers on campus ensuring that they accept Medicaid is really low-hanging fruit. I'm not saying it's easy, but it's low-hanging fruit. And then we think of housing assistance, we think of the Housing Choice Voucher Program, also Section 8. There are restrictions on housing programs that are kind of similar to like what we think of as FAFSA, dependency, independency status, like, are you married? Do you have a dependent? Are you over a certain age? Are you a veteran? If those things are true, then I guess what would be considered like independent student status, somebody could potentially be eligible for housing, but there are a whole bunch of restrictions on students getting access to housing who don't meet those criteria. So this is what we think of as comprehensive supports for students. Now, if I were at an institution and this information were new to me, I'd be feeling very overwhelmed, and I'm like, great, what do I do with all that? So luckily for you in Kentucky, you have KY Connect. And I'll connect this in just a second to some of the institutional opportunities, but it is an online portal by which anybody in Kentucky can identify if they're eligible for any of these benefits and then go ahead and apply for them. And there's like a really helpful pre-screening tool. Most states have online platforms. So just knowing that it exists, I included the web address. And these slides are available to everyone after the presentation as well. But just knowing that this exists and really emphasizing that I appreciate as staff, faculty, and administrators in higher education, you're continually asked to do more. And I can even feel, and I don't work in higher education, it kind of feels like you're carrying the weight of the world on your shoulders to make sure that students are successful. And so I just want to say that, like, if the only thing you can do when you're talking to a student is just to say, hey, we have a benefits website. I don't know if you're eligible. Frankly, I can't even promise you're able to get benefits, but I at least know it's there and you should try. Now, is it a pain in the butt to apply for? Yes, 100%. The government's not going to make it easy to, access any benefits or resources, but is it worth it? Absolutely. And that pre-screener tool is a good first step. So what have we learned? There have not been a ton of comprehensive studies. They've happened more at kind of an institutional level. At least I haven't seen a nationwide lit review. I might look into that. But what have we learned about helping connect students to supports? We have learned that it reduces students' unmet need. It improves financial stability, decreases debt levels, and complements existing federal and state funding streams. Virtually every state in the country has college completion goals. And when we think about the amount of time, money, and resources that federal and state governments are pumping into higher education success, thinking about leveraging federal and state supports that are already there to support those efforts just seems like common sense to me, but I realize I've been in this probably for a little bit too long. So, thinking about how your state can look across the funding streams and identify where can we align better with workforce, where can we improve some of these eligibility rules. And as Lily mentioned earlier, I'm working on a comprehensive policy scan right now of state policies to say, here are some flexibilities that you can take advantage of immediately. You don't need federal approval to do these. You could, in theory, take advantage of them. So immediate opportunities for institutions. It's important to keep the context of not only what students have faced historically, but their individual experiences in conversations about their student basic needs. Using a trauma-informed approach when developing communication and talking points is very important. And then thinking about surveying students about their needs and including students in the design of services is low-hanging fruit opportunity. I'm not saying you have time and capacity for it, but it is something that can be done immediately without a lot of additional lift. One of the other things that I think about is that KY Connect website, for example. Institutions communicate with their students in about 1 billion. Is that a pretty safe estimate? 1 billion different formats. So emails, syllabi, social media, flyers around campus, just including that public benefits are available and that there is a site that you could access to be able to apply for them seems like a pretty, low-hanging fruit opportunity as well. One of the other things that I like about that approach is it also normalizes talking about access to public benefits on campus. It's part of that communicating that culture of care and destigmatizing access to public benefits and normalizing that is and should be a conversation for your students on your campuses. Other opportunities that I have seen, and Kentucky already does a couple of these with the Ready to Work program and some connections with SNAP ENT, but there's also opportunities to just partner with your local human services agency to help students apply for access and troubleshoot their benefits applications. I worked with a college in Colorado who, like, once a week or once every other week, one of their local human services administrators would pop down to campus, bring their laptop, and they would just have like open enrollment for public benefits. And that just literally happened through an email that started a communication with their local human services agency. So I do want to reemphasize that knowing these resources are available to share with your students is really important. You don't have to be the benefits expert to open that door for them to find these benefits and to have those conversations. Let's see. Program flexibility, we're working on that one right now. And then working with community-based organizations, I worked with a community college in New Orleans, and they actually worked with a local faith-based organization who brought both crisis and longer-term mental health providers onto campus. So if a student had an immediate need, they were there. If a student needed to see somebody in an ongoing fashion, they were there. And that was at no cost to the institution other than having to find like a quiet private room to put them in. And then we think about some expanded opportunities that would require probably some state policy change. I work at not only federal and state levels of policy, but also within those, there's legislative policy, which everybody likes to talk about because it's like the sexy one. And then there's administrative policy. So these are your state plans. These are how your states interpret the federal rules, the choices that your states make about what the federal rules will allow. So that the student work exemption is one example. The 20-hour-a-week student SNAP exemption that would allow your state to average a student's work hours over an academic period as opposed to a month. Because when we think about who the students that we're trying to serve, the challenges that they face, they often have unpredictable work schedules, or they may be in jobs that are in the gig economy or in seasonal employment or retail, that it could look like they either had very high income over a time period that made them ineligible. But if you looked at that over a little bit of a longer time frame and you smooth that income effect out, they would have greater access to benefits. Okay, so I think this is a longer term goal if we wanted to think about this in Kentucky, but California and Massachusetts use their state TANF dollars to fund need-based aid. And the interesting thing about that is receipt of TANF allows somebody to be eligible for SNAP. It's called categorical eligibility, if you're interested. And a student who is getting a Cal grant or a Mass grant in California could also get access to SNAP by getting that need-based aid. So that's one of the beneficial ways to sort of connect those dots. Leveraging SNAP ENT, this is something your state is continuing to look at. As long as an institution is using non-federal dollars for their SNAP ENT services, they can then draw down that 50% match for their institutions. The state of Virginia is actually using their SNAP E&T dollars to fund Single Stop. I'm not sure how many people are familiar with Single Stop in Kentucky. Single Stop is an organization that actually provides what we would think of as like navigator services for benefits or wraparound supportive services. They help students apply for, troubleshoot their benefits applications, connect them to community resources. And as I mentioned before, SNAP E&T can be used to fund books, transportation, childcare, taking advantage of C Campus. So C Campus is the Child Care Access Means Parents in School program. It is the only federal child care program that is targeted specifically for post-secondary students. And it's available through the Department of Education for those of you that weren't aware of that. It's an annual grant program. It just received an additional bucket of federal funding. I don't know what that amount was off the top of my head. And then expanding Medicaid obviously improves health and education outcomes. And there's another state policy choice where if your state chose to, their childcare program, their state childcare subsidy program could include a person's ability to need study time that would cover part of their childcare subsidy. So in class time, work, and in addition to that, study time. Yeah, I guess that's the end. I'll open it up for questions. Yeah. I'm going to bring this down to you. Okay, so the question was, how do I see this work reflected in online classes? At present, I haven't seen that it has affected that greatly. Enrollment in online school has been essentially just treated the same as in seat for the purposes of benefits eligibility at this point. Thanks for your question. Other questions? I can bring the mic over to you, or you can just like yell really loud, whatever you think is best. Okay, so questions for you then. Who has basic needs activities or services on their campuses? Put those hands up. Come on, be proud. Okay, all right. Very exciting. Does that include sharing information about access to public benefits? Okay, all right. It's a tough one. I'll give it to you. I've been in this for a while and it's still confusing to me. No, it's not easy to talk about, honestly. And we actually find that that's one of the biggest barriers. The Government Accountability Office did a report a couple of years ago and found that 64% of potentially eligible students weren't actually receiving SNAP. And one of the main reasons was because the student eligibility rules, as you can tell, are very confusing, or else I would be out of a job. And it's very difficult to feel like you can talk confidently about something with a student that you don't understand. So working on simplifying those rules is incredibly important, not just for students, but to be able to talk about them in a way that actually makes sense, because I can't imagine your higher education career had a lot of background on the US social safety net and poverty metrics and benefits eligibility. So I think it's a big lift. Does anybody want to share anything specific about what they're doing at their institutions?
Yes. Hello, my name is Abby Hickey. I am a faculty at Eastern Kentucky University in the Food and Nutrition Department. And one thing we are doing actually this week is we are convening stakeholders at a meeting on campus to talk specifically about food insecurity. And so our whole plan is to have a student panel so they can tell us their experiences, and then have all our experts in the room, have all of our collaborators. And so then we can move forward with some kind of mission and goal. And so we're starting with our campus, but we're hoping to also expand to other campuses as well, and do assessments, do planning, do, evaluation. And so we're really excited. Yeah.
Anyone else? I might let you go a couple minutes early, but we're going to keep going for a couple minutes. Yes, please.
What advice would you give to a community college trying to better partnership for childcare assistance, especially for C, and other programs such as that?
Thank you for your question. So the question was, what advice would I give to community colleges who are trying to prepare better to improve students' access to childcare? The first one would be C Campus. If your institution has not applied for a C Campus grant, I highly recommend it. C Campus provides funding to institutions to provide childcare vouchers, and that can be for students for on or off-campus childcare. So you do not have to have an on-campus childcare center if you want to access a C Campus grant. The other thing that I would recommend would be encouraging people to apply for your CCAP, I believe is your acronym in Kentucky, your Child Care Assistance Program, where they could have access to a child care subsidy. Did that answer your questions? Okay, great. Thanks. The session end at 4:30? 4:15? Okay. Yes.
So I'm a grant person. I write grants for the institution. And what I don't know is what data systems are out there that help us connect the dots. How do I know how many students on my campus receive those benefits, even if I don't know them by name?
Travis, are you dying to answer this question? The question was, what data systems are available to help understand the need on campus and how to articulate which students may need what resources?
Hello. Hello, I'm Travis Muncie. I'm the Executive Director of Data and Advanced Analytics at the Council. And we don't have too many, I guess, post-secondary statewide systems around this. We do have student financial aid. So what we can do is try to identify students with need through their financial aid records. So that's usually what we'll do. One of the big projects that we are in the process of finishing is around student unmet need, so that we can identify those students and find, what students are most likely to not be retained or other student success factors around student unmet needs. So I know a lot of campuses around our work with student basic need. They keep data internally, but from a post-secondary statewide, we're really limited to the student financial aid records, FAFSA records, things like that.
Yeah. Okay. Also, in addition to that, inside the impact exchange in our basic needs resource, you should see a dashboard around basic needs accessibility. So it is going to be only inclusive of public institutions, but if you're a 2-year or a 4-year institution, you can sort by your institution and see what % of my students, and this is based on previous enrollment records, received public benefits, and that would be inclusive of SNAP and KTAP. You can also, so enrollment is going to be the first screen on the dashboard. There's, I believe, a success button you can click over to the right, and that will bring you to look at retention and completion for your students that receive benefits. So that could be helpful as you're trying to write grants and just look at the outcomes of some of your students.
Thanks, Lily. Thanks, Travis. A follow-up question on the, I'm coming to you. One other thing that I just wanted to add is that there is not a federal database on student eligibility, and states do not track which exemptions students use. So that data is very limited.
Unrelated question to that. But we work with schools and communities in far southeastern Kentucky where internet access is a real barrier. And when I think about this sort of holistic basic needs piece, there's so much expanding coursework that's online. To even get on Kentucky Connect requires a strong internet connection. So I'm wondering if you've found grant programs, state or federal, that really accelerate internet access for students.
I mean, that's a great flag. Thank you very much for raising that. Going to add that into my chart. It is not a issue that I have focused on in great detail, but you're right. It's so integral to everything that students would need to be able to access, school or the KY Connect. So the short answer is I don't know right off the top of my head, but it's certainly something that I can try to find some information on and get back to you with. If somebody else knows of resources for connecting students to Wi-Fi to share with her, you're welcome to throw your hand up. Okay. Okay, well, with that, I'm going to end the session. Thank you all very much. And I think, oh, Lily's closing.
Give me a second. Thanks, everybody. Okay, oh yeah, let's give a round of applause to Carrie. And we'll be continuing this conversation tomorrow with some more active workshopping and hopefully some great planning among your campuses with the teams that you've brought with you. So just to close out, a couple of housekeeping. Tomorrow morning, breakfast begins at 7:45 a.m. in that big, this is it, 212. And all of these air walls will be open, so it'll look like a gigantic room where we'll have a yummy breakfast. And we'll also have our opening plenaries around equity by design, as well as continuous improvement approach to student success. Yeah. Next up is a networking reception. And that is actually going to be right out here, just beyond these doors in this big open hallway. And I believe that we'll also be able to kind of funnel into these rooms as well. And so we'll have some nice heavy hors d'oeuvres. We'll also have a cash bar. So we hope that you kind of stay, talk with colleagues, share whatever you got out of today. But if we don't see you this evening, we definitely look forward to seeing you all tomorrow morning. Thank you.